You began by saying something about panic, that we saw a picture there of Nigerians wearing face masks and all of that. Are you meeting with the media? Are you in contact with the media to help in the caption of headlines and all of that?
Yes, we have held quite a number of press conferences, media briefings, myself, Commissioner for Health and SA Health. As a matter of fact, on this issue, His Excellency the Governor himself is the incident commander. He has been the one championing public education about this. To that extent, on Monday alone, we met with members of the diplomatic community, religious leaders, traditional rulers, chairmen, all the 57 chairmen of council in Lagos State, medical officers of health, that is doctors who are in charge of healthcare delivery at the local government level, and other health workers at the local government level. The governor addressed them by himself to put across certain information to disabuse people's minds. An example is the one I brought to you. I saw this in yesterday's newspapers, people wearing masks. It tells you that we still have a lot of work to do in educating people. Okay. We have started doing it, we are doing it, but that what is on the front page of some newspapers yesterday shows that we still have quite a lot of work to do.
All right, let me also drop this. Maybe that might add to the work that should also be done. Someone said that a protocol officer that picked up the Liberian at the airport, I mean, yes, we understand, died 2 days ago. But he's been in his house in Ilukbeju, and the pregnant wife and the child are still living in Ilukbeju. He said the Ebola numbers are not reachable, even the numbers of the Ebola committee chairman. So he wants to know why they are not being quarantined, as they keep saying. And he says the man died, went to Ilukbeju Private Hospital and was treated for malaria. He wants to know what's going on.
You see, all the contacts, there are two categories of contacts. There are primary contacts, those ones are being quarantined, to the best of my knowledge. The secondary contacts, you cannot bring them into a hospital. So secondary contacts are being followed up.
In their houses?
Yes, mostly. First of all, they are not showing signs of the disease. So as a matter of fact, they can't infect people, but they are being closely monitored. They are being advised not to move around. You know, there are people watching, and there are tests being carried, like the thermometer that I told you. And about the helpline, we have had complaints about that. I must acknowledge it. But it's because there have been so many hits on the line, so there will be a lot of drop calls. That's why we have provided alternatives. My own number is out there. It has always been. I'm an emergency manager. So the number of the Honorable Commissioner for Health and SA Health, the MD, Chief Medical Director of LASUT, and anybody really in the Ministry of Health, Lagos State.
Well, we're thinking, though, that you would have, like, some call center. If people are calling Ebola help, it's not just one person or just one number. We're thinking it's a number that links possibly a host of other numbers, and if you're going to be waiting for your call to be picked up, it's going to, like a service center, call service center.
That is being put in place.
Oh, it's not yet in place.
That is being put in place presently. But that Ebola help, 0800 Ebola help, is working. It's just that we have had complaints that some people cannot reach it. But there are alternatives.
Let me revisit this. I think something is not quite clear, because from what this person seems to be saying, when he said that the protocol officer that picked up the Liberian at the airport died 2 days ago, he went on to say that he was in his house. I thought that this is a primary contact. He's supposed to have been quarantined.
No, nobody died of Ebola in his house, to the best of my knowledge. Because nobody died of Ebola disease in his house.
Not even the driver who...
Nobody has died of Ebola disease in his house.
Okay, but was he quarantined? Because from what he's saying, that the chap had been living in his house with a family, with a pregnant wife.
Anybody that has been confirmed as an Ebola disease patient had been under quarantine. It takes days.
That's the primary contact now?
Yes.
Or even the secondary ones?
Whoever has died of the disease must have been under quarantine. You know why? It takes days for the results to come out. The tests are in 3 stages. First one, second one, final confirmation. So it takes days for you to get the results.
Okay.
So the person that is being tested had been under quarantine. So if by the time somebody is confirmed as having the disease, the person couldn't possibly remain in his house. So I don't want to address the particular issue for fear of contradiction.
Okay, but you know that while you're trying to prevent people from panicking, you know, it will be difficult for everybody to get the message at the same time about the primary, the secondary, and tertiary contacts.
Yes.
So the impression that many will have is that anyone who has had some form of contact with any person who has the disease should not be living in their house. They have this perception that they should be quarantined. And so when that is not the case, what do you tell them? How do they handle it?
They should stay away from anybody they are suspecting. If I am suspecting you and you want to shake my hand, I wouldn't take it. You understand? This thing is fresh, is happening. There will still be a lot of cloudiness about it initially, before we all understand it better and be able to subdue and conquer it. So there will be issues. And that's why I insist that, you see, what we should do is to let people know certain basic things. All those issues that, you know, have some cloudiness and controversy, as much as possible, well, your responsibility here is to try and get clarity on certain issues. I agree. I wouldn't fault that. But at the same time, if we dwell too much on those controversial issues, it may make us lose focus on certain messages that we should seize this brilliant opportunity to put across to the people. And that is one, that you can have this thing through the air is by close contact with body fluids of the person who has come down visibly with the disease, who is visibly sick with the disease. And if you see somebody with fever, diarrhea, vomiting, or is visibly sick and prostrate, because Dr. Sawyer, by the time he came down from the aircraft, he was prostrate. He could barely walk. And people rushed at him. That was how the issue of the protocol officer came about. And in the hospital, I mean, because they couldn't think of Ebola initially when he got into the hospital, they went about their business normally, the way they attend to their patients. Malaria negative, typhoid negative, other things that could cause fever, diarrhea, and vomiting negative. That was how one sharp doctor there thought, come, this man is coming from Liberia. There is Ebola there. Then it dawned on them, but they were good enough to let us know. So the person will be prostrate, visibly sick. But if you have reasonable ground to suspect that this person is looking sick to you, stay away from the person. It's like the issue of bushmeat. The virus resides in some primates. Now, some people eat bushmeat. They have been asking us, can they get it if you cook your bushmeat well enough? It's not going to be dangerous. But at this time, when a lot of things are not clear yet, if you ask me, because I have cow meat, I have ram meat, I have chicken, I think I will just eat those ones for now.
You know, very
and
recently,
leave bushmeat.
I don't